My name is Tracy Frech. I am a rheumatologist that's trained in pediatrics and internal medicine. I trained at the University of Utah, and I've been there since 2001. I'm the director of the systemic sclerosis clinic there, and I have the great privilege of transitioning pediatric patients from our pediatric rheumatologists. One of the topics that I think is most important for any patient or caregiver of a patient with systemic sclerosis is understanding the fundamentals of nutrition, and that's what we'll cover today. So probably the most important question that you can ask your doctor is, why does nutrition matter? It's really the most fundamental aspect for healing and gets our tissues the nutrients it needs to function and heal. Most importantly, the gastrointestinal tract, which includes the mouth, all the way from esophagus, stomach, small and large bowel, anus, and rectum, has many different functions to make our bodies work well, but importantly, that's where the large majority of our immune system lives. And that immune system has to make decisions every day. It has to keep the gastrointestinal tract healthy enough to extract nutrients from our foods and patrol that gastrointestinal tract for damage and help healing. So nutrition not only is important for gastrointestinal health, but also important for all of our healing tissues. The importance of nutrition mostly is to keep our immune system in balance. And so I like this picture as we kind of go through the topics of nutrition, because it visualizes the fundamental components of how our body works. So if we think of this as a seesaw or a balance, the cells that line our GI tract are called epithelial cells. They're the same types of cells that are present on the skin. And those epithelial cells are barrier cells. And they have to stay in balance between cells that are going to go ahead and try to attack an invader and recruit all the chemical messengers that say we're under a threat. We need to clear this trigger. And those cells that come and clean up the damage. And so happy epithelial cells are in perfect balance between those cells that are attacking and the cells that are clearing that damage. Probably one of the better known examples of an immune system that's a little bit out of balance is those GI tracts that are sensitive to gluten. And oftentimes people will say, well, I was tested for gluten sensitivity and my tests were negative. But oftentimes a sick gut feels better gluten-free. So there's a difference between gluten allergy and gluten sensitivity. And a lot of folks that have a gut that's not feeling well are gluten sensitive. So it's a good example both of a food type that we want to avoid when we're feeling ill, and also a good example of what's going on in the immune system. So let's walk through this example. So usually your immune system has sort of different phases of reaction. There can be an immediate reaction, and that occurs on the lining of the epithelium. I like to point out that those GI tract lining cells here look like little fingers. So what I like to explain is, in the same way you can see Raynaud's of your fingers, that whole phenomenon of spasm or Raynaud's of the gut can occur as well. And when those cells are not very happy or reactive, they can leak. In the same way that when you see fingers that have Raynaud's and then the hands get puffy, in the same example, when the GI tract lining cells aren't functioning well, then they leak. When they leak, gluten gets into a space it's not supposed to. So this epithelial lining cell is supposed to do a really good job of extracting nutrients and then getting rid of waste. That immediate reaction is sometimes when your child may say, I don't feel good right after eating. There can be that immediate response. Over time, so in the innate immune system, if there's a repeat injury or a repeat reaction, the body tries to get smarter and recruits all of those cells. Oops, excuse me, wrong direction. So that would be as if these epithelial cells no longer are happy, they're damaged, so that we're bringing in recruiting cells that are saying, hey, there's something here that's not supposed to be here, we should clear this insult. Unfortunately, when there's repeat exposure to something those gut lining cells really don't like, the cleanup can't occur in a timely manner. And unfortunately, we see actual damage to the epithelial cells, and therefore leaking occurs more commonly. And so it just sets up this process of weeks to years of over and over again, an insult occurring. So really, this is our best example of our goal when we talk about nutrition, is to keep these gut lining cells happy so that there's a proper balance of cells that can attack and clean up. The way we do that, we approach gut health, is with a balanced diet. And so we tend to think of a healthy source of 6 essential nutrients when we talk about a balanced diet. Now, we know that when we eat a meal, there needs to be protein, carbohydrates, and fats. Those are how we get our calories. And then we need our minerals, vitamins, and water for cells to do their right processing. And we're going to go through each of these different categories with a little bit of with a little bit more detail. So in pediatrics, you may realize that we oftentimes weight-base our medications. We also need to understand what a healthy weight is for our child and how many calories they need based on their age. And I point out that particularly during our puberty years, we need more calories, that hormones take a lot more fat sources. And so understanding how many calories your child needs and how to get there is really the fundamental aspects of eating well. When we talk about calories, we're talking about 3 of those 6 essential nutrients. That includes protein, fats, and carbohydrates. Here's the really tricky thing when we're trying to calorie count, and this is why it can drive you a little bit crazy when you're trying to do a really good job with a diary and you don't feel like your child's getting enough calories in. The reason is our calorie counts can be imprecise, and so we do know that 1 gram of fat compared to carbohydrates provides more calories. But we don't absorb all those calories, and particularly in a sick gut, and in patients that, if you've noticed, you've had frothy sort of stools that float to the top of the toilet bowl, that's a lot of non-absorbed fat, that you could be giving a lot of fat and just not absorbing it. So it gets a little bit frustrating. Furthermore, food companies may use 5 different methods to estimate calories. And so really those calorie estimates are more of a range than an actually true source of information. The reason that's important, particularly if you're really targeting a calorie goal and you feel that your child's having a lot of frothy or fatty stools, it may be that you have to target a higher calorie goal to get weight up. Additionally, how we cook our food doesn't go into that food label. So chopping or blending food can increase the number of calories absorbed. That's a good trick if you're trying to get calories into your child. Additionally, I just point out how we cook our food can increase the fat calories. And that's really because when we are grilling, we're getting more of that fat into a liquefied form that seeps into the meat as opposed to cutting it off on the side of the meat. But when those food companies are reporting calories, they're not taking into account how you're preparing or how you're cooking it. And again, we really don't absorb all the calories we consume. So talking to your physician about what your calorie goals can become an important aspect of management and care if we're targeting an ultimate goal. Lastly, we're going to talk a little bit about a biofilm and the microbiota that lives in our gut. And I think it's fairly interesting that we are more bacterial than human. We carry a lot of bacteria in our gut. And so in that bacteria is helping those healthy epithelial cells do their job better. So they're sort of the watchdogs of that epithelium, and they can help your gut health or they can harm it. And importantly, they can really influence how many calories you absorb. And so what microbiome lives in your gut can influence our overall calorie counts. So what is the role of bacteria in our gut? Nutrition can influence that gut bacteria and our gut barrier. It alters our immunity. And I'll give the best example probably of this is small bacterial overgrowth. Folks, at this point, I'd probably have you raise your hand if you've heard that term, but I'm going to just go ahead and explain it. Bacterial overgrowth is when bad bacteria are out of proportion of the good bacteria in your gut. And so if there's too much bad bacteria, it can influence your ability to absorb nutrients, and it can also cause quite a few symptoms. One of the important aspects of systemic sclerosis is this is a chronic disease. And so I think it's really important that we think about gut health lifelong. And whether you have scleroderma or you're a caregiver of a patient with scleroderma, gut health is important to all of us. And eating healthy and understanding your symptoms is a critical aspect of moving forward with a better understanding of how the biofilm is properly activated in our gut. What I mean by that is the last point here. How medications influence the healthy bacteria in our gut is not well characterized. And this is where I usually use a lot of questionnaires for patients. There's a Scleroderma Clinical Trials Consortium, a GI2 2.0 questionnaire that's available online. If your child's getting a new medication, tracking how they feel is a really important aspect. I think we shouldn't ignore gastrointestinal symptoms because, again, we don't really understand how medications interact with the gut, but we need to listen to our patients in order to move forward and doing a better job with nutrition and gut health. So all gastrointestinal symptoms are important, and trying to identify how we can get the right nutrients into the body and keep the gut happy is really our ultimate goal with eating well. So how do we influence bacteria in the gut? I'm going to talk a little bit about the different aspects of things that have been studied somewhat. The first is probiotics. So probiotics include drugs like Culturelle or Align. Those are medications. Culturelle is more of a lactobacillus. Align is bifidobacterium. Back to that last slide, there's different bacteria that live in the gut, and we're trying to get the good guys in there, trying to put the good bacteria in there so the bad bacteria doesn't overgrow. Probiotics, however, are not well studied by the FDA. They're a food supplement, so you can go to the store and just by trial and error, see what probiotic is best for your child. Or some people say, I just prefer to do the yogurt and try to get, or fermented foods to try to get probiotics at a natural source into the gut. Again, the important thing to realize is they haven't been adequately studied. They're not regulated. We're going to talk a little bit about that when we get to supplements. But they are something to be aware of, particularly if there's a lot of bloating or abdominal discomfort and there's been recent antibiotics. Trying to put some good bacteria in the gut does make sense. There's also prebiotics. So prebiotics depend on your own healthy gut flora to thrive. So you give non-absorbed carbohydrates that we know the good guy bacteria in our gut loves, and that helps them do their job better. In a gut that's really sick, trying to put more prebiotics into it can actually make the gut feel kind of sick. So it's important to know sort of the status of the gut when you're making a decision on prebiotics. And that can be lots of fiber supplements. And a sick gut doesn't love a lot of fiber because it's just putting food into a gut and the good bacteria are just not there to be able to process it. What about antibiotics? So I always try to explain to folks that antibacterial activity can have positive or negative effects, and so this gets really tricky. If there is an infected digital ulcer, so we're giving an antibiotic, the first thing I ask my patients when I see them back is, how's your gut doing? Because that antibacterial activity that we're trying to target the bacteria that's living on the skin ulcer is also going to affect the gut bacteria. So we have to really, again, any new medication addition, and I ask our kiddos, how's your tummy feel? How can we make it feel better? And then we're going to go to more sort of nutrient-based foods that we're going to talk about. There is a medication that we use commonly in the adult world called rifaximin, which is a non-absorbable antibiotic. And in that case, we're giving an antibiotic that just acts locally to kill the bad bacteria in the gut and doesn't have a systemic absorption. That's why I say it can have a positive effect. So we do need to use antibiotics for medical care, but understanding how that's going to affect the good bacteria in our gut and a nutrient uptake is an important aspect. And that's why I put this picture back here. We really, in every individual, are trying to keep those gut lining cells happy with the right balance of attack cells and cleanup cells. And our goal is not to get rid of the attack cells completely. We need to be able to patrol the body for infections, but we want to make sure that we have balance in the body. So how do we get there? So what healthy eating can do for you, this is a slide that's sort of busy, and you can't certainly see it on your handout, but my point here is that nutrients do lots of different things for all parts of our body. And so in order, whether your child has mostly skin involvement, whether there's mostly gut involvement, whether there's lung, nutrients are the cornerstone for keeping those tissues healthy in the repair mechanism. And as we go through these vitamins in more details, you can see this slide a little bit better. I like to point out that natural sources of vitamins are best. And the reason is our bodies are really smart. And so oftentimes if we just try to put all these jam-packed nutrients or vitamins in a single pill, the body doesn't get the chance to break down the food products and absorb the nutrients. And a lot of times if you're just given a pill with all this, it'll be excreted in the stool and you're not able to absorb it. So what I like to encourage patients and families to do is try to understand those natural sources and be able to get them, whether they're in a blended form, into the body so that the body can use those natural sources of vitamins to do their job. And certainly if folks will ask particularly about B complex vitamins or those fat-soluble vitamins, which are A, D, E, and K, the key not so much is trying to force your kiddo to eat lots and lots of volume. It's more understanding the value of the nutrients that you're putting into their bodies so that they can heal. What about dietary minerals? This is tricky as well because minerals are essential inorganic nutrients that are in minute fractions of food. So it's super tricky because you just need tiny amount of these minerals for your body to do their job. But if you're lacking the mineral, then your body really can't function. They tend to be classified as macronutrients, and these are the ones that are more easily checked by blood levels. That's your calcium, phosphate, potassium, sodium chloride. Those come back in your routine laboratories and you can see those levels. And you've probably noticed most of the time when you get those levels back, there's a range on the lab sheet. And the levels usually within that range because our body does a really good job of trying to maintain the balance of these macronutrients. Some of the trace elements, cobalt, iodine, zinc, those are harder levels to check by laboratory, and this gets a little bit tricky. And when I do defer to the nutritionist, when we really are trying to check levels that are hard just to detect by serum because they live inside a cell, oftentimes more advanced testing by certain specialized laboratories are necessary. So if you're really worried about a specific deficiency, at that point really getting some testing done by a nutritionist can be important. Otherwise, just making sure that you're aware of how to get minerals into the diet can be the first line approach. I do want to talk a bit about water because this question comes up quite a bit in clinic. So water is 70% of our human body. Water's tricky because if you drink way too much water, you can drop your sodium. And when you drop your sodium, this can make you feel really sick and kind of dizzy and off. The kind of best example of this is the football players that go out in summer camps and the coach says, drink, 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 drink. And then the kiddo comes home and it has dropped their sodium and they feel really sick and off. And so there is the right amount of water for hydration. However, important to realize a point to that is it has no caloric value. So one of the questions that came in from one of the parents is, I'm really concerned when my child's on steroids, they really tend to overeat. How can I combat that? Water is your best friend in that situation, in that having your kiddo drink a big glass of water before every meal can help fill the stomach a little and minimize some of the caloric intake. The alkaline water question is really a hot area, and I get asked a lot. The problem is it's not extensively studied by proper study design and is controversial. Probably most of the research is in the osteoporosis world. But when we talk about alkaline water, we're talking about the pH. A neutral pH is 7, and you have alkaline pH, which is 8 to 11, or excuse me, 14. Usually 8 to 11 is where people will try to target when they're trying to do an alkaline diet or alkaline water. And the whole idea of that is that that can help patients that have over acid production and help them feel better. Again, the problem is this hasn't been exclusively studied, and so some of those units, so the different water units available online can be pretty expensive. So again, hasn't been studied. Data still not clear of how it will benefit, but the idea that acid helps, an acidic pH can make the bad bacteria ramp up their activity, and that the alkaline pH does a better job of calming those bacteria down. What about dietary supplements? So I like to think of how you approach your diet in our pediatric population as you sit down every night and you're trying to figure out the best meal for your child. And like everyone, you're having to balance that with being super busy and having lots going on. And so you're really trying to say, how can I get the right amount of fruits, vegetables, proteins, grains that are maybe gluten-free, dairy into my kiddo? And when you look at what your kiddo's eating and you're trying to add up those calories and you're doing your best job and you say, I don't think I'm getting enough, let's say, protein into my child, so I think I need more amino acids, which are the building blocks of proteins. I need to get that into the diet to help build muscle and to build the essential healing aspects of the part of the immune system. So how do we do that? We start by going to credible sources. I oftentimes think that supplements are a little bit tricky because they're not FDA regulated. We're going to talk about that on the next slide. But they feel safe, right? So if you can go to the grocery store and you can just buy them off the shelf, or you can go on the internet and you don't need a prescription, that feels safer because they're not being regulated. The problem is, of course, that they're not being regulated. And so really talking through with your physician medication interactions, whether you need it, whether that's an unnecessary expense to your family because most of it's being excreted, that can be an important conversation. I think for kind of basic questions regarding supplements, this is a very nice link from the NIH.gov. And as part of that discussion, they talk about some important points, which I wanted to make sure I brought up at this talk. So because they're not regulated, they can get marketed before all the safety and regulatory work is done. If you've ever been in a clinical research trial with your child, you've probably realized that you have to sign so many consents, it makes you sort of nervous. Then any side effect you have during that trial is captured and discussed, and even if you've yet to even receive a drug and you get a common cold, if you've been consented and you haven't even received a drug, in that marketing of that drug, they'll say this study patient had runny nose, sore throat. Even though they didn't receive the drug, that could have caused those symptoms. So when we do clinical trials and we're trying to figure out drug safety, there's a lot that goes into that. Unlike supplements, it's a real problem because it's the opposite. It's considered a food product and it's safe until someone says it's not safe and there's enough safety signal in the community. And then it's the manufacturer or the distributor's job to tell the FDA that that's not safe, and they are labels. They can really claim anything they want on the labels. So I just say cautions. There is a role for supplements for maintaining nutrition, but that's really done best under the guidance, I think, of a nutritionist. And we'll talk a little bit more about that in the next slide. If anyone's been to one of my adult talks, this is a slide that I've used before. So I think the most important aspect of starting a nutritional plan is really making sure that we understand some fundamentals. I hate for patients to go through a nutritionist and buy supplements or do anything without first doing these fundamentals. First, talking with your kiddo, or if you're the patient, about your appetite fluctuations. This is a really important aspect. Some kiddos are just not hungry in the morning, but if they're hungry at 10 a.m., that's your educational care plan you're gonna have with a teacher. Because you need to get calories into your kiddo, and if there's certain times of the day that their appetite is better, we wanna target that, and we don't wanna constrain our kids to having to eat at certain times. So that's one of the things that are important of getting a good nutritional plan is appetite fluctuations. What about taste changes? So if your kiddo started a new medication that affects their taste, that's really that's something a kiddo may not tell you because it's a hard concept. They might say, this tastes funny. But if you notice foods that they used to like, now a lot of them taste funny, a side effect of medication can be taste change. So that's something that's reasonable to ask if you're starting new therapies. And then also, again, those food and drug interactions, asking your physician, is this medication best taken on an empty stomach or food? That's important for planning your day. My goal with my pediatric patients as well as my young adults, really with all my patients, is to not have it feel like you have a disease, because it feels bad to feel like a disease is ruling your life. So just that first step for nutrition, and eating is such a large part of our culture, of asking, how can we get nutrients into our child without it feeling like a full-time job, is probably the most important first step when we talk about nutrition. What about skills and ability to comply with dietary lifestyles? I think that's really important, particularly with parents of teenage children. It's important for children to feel independence and that they're making their decisions. So giving them options and letting them sort of pick and be in control is really an important aspect of that transition into adulthood. And so knowing how many calories they need, but working with them and letting them make the choices can be a really important step with moving forward with a good educational plan. And then in particularly our smaller children, expert consultation with a registered dietitian can be really helpful. And the reason that is helpful is it helps take it off the parent. And this is where I feel that there's too much pressure on our parents to have to be the doctor and to be the person that's having to, force decisions on your child. So sometimes getting to be the good guy and meeting with the dietitian and having the dietitian say, these are our goals, and talking through it can be a way that you can help empower your child to make those healthy decisions. I talk a lot about the FODMAP diet. And so this is a diet that essentially was developed mostly for irritable bowel disease patients. It's a diet that has is trying to help reduce the amount of poorly absorbed, osmotically active, that means foods that draw water into the gut and cause a lot of bloating and pain. This is the tricky thing, though, and we'll talk about it in the next slide, is its long-term effects haven't been studied. So it's a great go-to diet when the gut feels sick for any patient, because irritable bowel or a gut is just not quite feeling right. That's the immediate reaction when we showed of those, that you have that innate or immediate response to food types. This is a really reasonable diet to start with if your gut's feeling kind of sick. However, it's a good short-term plan. So what this involves is real dietary vigilance for 6 to 8 weeks. And then asking those questions, does the gut feel better? And most of the time, patients will say, oh yeah, I feel a lot better. Then you start reintroducing different food types. If you can't reintroduce anything, the gut's still really sick, at that point, really talking with a trained dietitian becomes a critical aspect of moving forward. Because what we don't want to do is decrease the nutrients that keep that balance in place. So we want to keep those healthy gut lining cells with the right proper nutrients. We do need to give the gut rest sometimes when the immune system is very active. But our goal again is to get the gut functioning as normal as possible all of the time. So what is a dietitian? This is an expert in human nutrition and regulation of the diet. A nutritionist will work with an individual patient goal to help get that patient's nutrients where they need to be. And this is, again, where those send-out tests for those micronutrients may play a role. The dietitians are licensed, and so oftentimes that is important to understand. If you go to your insurance card and you call on the back to see if there's dietitians approved with your plan, because about 10 visits can be covered. And oftentimes, if you get the name of a dietitian from your insurance plan, and then you call, you can see if they have an area of expertise. So a lot of nutritionists will be experts in sports medicine or food or allergy nutrition. One caveat I usually like to use, if you meet with a dietitian and they try to sell you lots and lots of supplements that they've made, and that's a large price tag, I generally say I discourage that. I think what your goal when you go to the nutritionist is education, an understanding of what food types individually can meet your child's needs. And then also if there's any additional testing that's indicated, particularly if you really can't liberalize your diet without having a lot of gastrointestinal symptoms. That brings us to allergy testing. So allergy testing, the role in systemic sclerosis is unclear. I'm a big advocate, I've said it before at other of my adult tests in my patients that really have a lot of GI tract symptoms, because I've had a lot of success in finding something, and nothing feels better as a physician than to see your patient feel better. And so honestly, if there's really pervasive symptoms all of the time, it could be something that's in the diet all the time. Testing can involve skin prick, patch testing, blood testing. Allergists may do it many different ways. But the real ultimate goal is to identify that trigger to see if you can get that gut back in balance. And so particularly if you're at your wit's end and you say, I just really feel like there's something there, we need to do a better job. There are some blood tests that your physician can send, such as histamine levels and such, to try to get some clues. But to be honest, I think meeting with an allergist to have that testing, if you can't liberalize things, is a good next step. So why is it important to understand and track nutrition? We started the talk by saying, well, it's the building blocks for health. Your gut has to make lots of important decisions. An unhappy gut has an unhappy patient. Whether you have systemic sclerosis or any other condition, when your gut doesn't feel good, you don't feel good. But in particularly in systemic sclerosis, these are adult populations, but these are looking at whole study populations. And the one on the end, where 25% of our patients we found to have clinical symptoms of malnutrition. The most fascinating part of that are most patients had tried something. So they had tried to go gluten-free, they had tried to go lactose-free, they were really struggling with trying to identify what was causing those GI tract symptoms. And there had been many, many years of trying these different interventions. And when they went to the physician or the gastroenterologist, the testing, so the visualization, the scopes, everything was normal. And so I think that really speaks to the fact that we have to do a better job understanding symptoms and giving our patients the resources to navigate nutrition so that we don't develop malnutrition. We've missed the opportunity for intervention if the patient is malnourished. So how do we meet nutritional needs? The best thing we can do is food by mouth, and that's because those gut lining cells, the little guys in the blue circles, they do best by a constant exposure to nutrients. But sometimes when the gut's particularly sick, your physician may say we need to meet our nutritional needs intravenously, and either that can be peripheral through an IV or by a central line, and those are feeds or the building blocks to nutrition that are put in by the vein. We don't like to do that because, again, the gut really does need that constant stimulus of good nutrients affecting its health and preventing the vascular leak. If there's there's just not a way to get enough food by mouth, sometimes a nasogastric tube can be placed, and that's where a feeding tube is placed through the nose and into the stomach. In Scleroderma, because there's quite a few changes to the base of the esophagus, that tube may be placed further and be called a jejunal tube, and that's to reduce the amount of reflux that may occur through the esophagus. As you can imagine, that is a very irritating tube, so instead a gastric tube can be placed. And this is what I really point out for patients, because oftentimes if your physician has recommended a gastric tube, to your child, that feels really invasive, and it's sort of a panic feeling that we've lost ground, we've gotten in a really bad place. You easily can graduate from these tubes. So if a tube's placed to get the nutrients up, again, the goal is to get nutrients up, to get things healed, to have the gut feel a little bit healthier, then to remove the food and meet the nutrients needs by mouth. And so these can be very temporary. But I will point out, because this has come up quite a bit, I think, in some of the referring hospitals to our center, is that when we look at enteral feeding tube feeds, this is important to realize that a nutritionist should sit down and help you understand what's the best feed for your child. And the reason that's so important is it's not the cheapest, it's not what your insurance company is going to say is necessary. It's really a very individualized plan that takes into account the caloric density, what's the protein source, what's the osmolality, how much water is that going to draw into the gut, particularly if there's a lot of diarrhea, and how much extra features such as vitamin C and zinc are needed for your particular child. So my point here is that the right feeds for your children should be directed by a nutritionist, not by an insurance company. Also, this slide is busy, but it's intentionally so. So some of my slides are just to kind of show the complexity. I think the importance of having enteral feed, so if your child is given a feeding tube, that you feel very comfortable as a caregiver how to manage that tube. I've also seen this happen. Tube gets placed and then the poor patient's sent out of the hospital. In the hospital, the nurses are given this extensive amount of training on how to start and end the feeds, what formulas are best for that type of tube, how to reduce bacteria around the tube, how to administer it, where the body position should be for feeding tubes, whether medications are needed to move the bowel along in the setting of the feeding tubes, if there's a blockage, how to deal with that. And so if your child is ever placed on a feeding tube, again, it's temporary. You have to remember these things are just to help that gut heal, but most importantly, even though it's temporary, that you get the education that's needed. This is the last slide before we summarize, because I do want time for questions. How do we combat that steroid-induced hunger? And so this is a real problem because steroids oftentimes are used for inflammatory arthritis or inflammatory muscle aspects of the disease. They're necessary, but they're necessary to be reviewed every visit. So oftentimes, once you get a good response with a medication, the natural inclination is like, oh, we're in a good place. We should just hold these medications where they're at. Every visit review, particularly that steroid dose with your provider, can be an important aspect of health. You also should make sure you know why it's indicated. So steroids are commonly used for inflammatory joint and muscle disease. They can be used in inflammatory lung disease, that's the interstitial lung disease, but these really should be at the lowest dose that can be used to keep the disease in a quiet state. Things we can do, though, if you're at the lowest dose and your child's still really hungry. First, we talked about that glass of water before each meal or snack. We can also ask our kids, the first question I always love to ask is, well, what are you hungry for? What are you craving? And if you're having food cravings, it's usually indicative of some other type of micronutrient or macronutrient. And then you can eat an alternative food type in that category, and that can sometimes help reduce the craving. Additionally, it's okay to eat, but we need to exercise too. Exercise could be particularly challenging if there's muscle or joint involvement, but there's little things you can do. So when you go to the grocery store with them, you park at the very furthest parking spot. You take the stairs instead of the elevator. These are little things, and you can take as much time as you need to get there. It doesn't have to be high intensity, but trying to get those steps in. I've had a couple of parents say that they felt that one of the good gifts to get was a Fitbit because it makes the celebration when they get to a certain number of steps. And so that can be something that you can consider too, to try to encourage your child to increase their activity. So in summary, Malnutrition in scleroderma is really an important consideration. So it's something that occurs slowly over time, and that's why it's really hard for us to do as good of a job as we should in identifying it and treating it. However, nutrition helps us heal, and so keeping our dietary needs, or knowing what our dietary needs are, is an important aspect of wellness. It's good for the whole family. So just having a good understanding of the building blocks of health helps keep everyone in the family well. A registered dietitian really will individualize those nutrition plans to meet personal needs. And steroids can increase appetite, so be aware of that. But using water and healthy craving alternatives and exercise can help us maintain that healthy weight. This is just the standard slide because this is taped. I don't have any conflicts of interest. All the figures were referenced. Otherwise, some of the images were off Google for free. And this is all for educational purposes. And very lastly, I just always like to thank, most importantly, all of the patients and parents of patients that work tirelessly as a community for us to do better and move forward. We truly are a community working towards a common goal. And I can't tell you how much I appreciate your attention and your time today for trying to learn what we do at our center. And then very lastly, I'm happy to take questions.
If you have a question, I'm going to bring you the mic so everyone can hear you.
I have a couple of questions. One, I kind of wanted to throw out there. We do work with an allergist, like your one slide talked about. I know that I've talked to other parents who had allergy testing and they had minimal information from that. And I just wanted to throw out there that a majority of the kids that I've talked to, families, they're on methotrexate, which is an immunosuppressant. So if you think about it, when you have allergy testing done, you're seeing what you're most allergic to, and what you're most allergic to is what your immune system is attacking. So we're giving these kids methotrexate, which is reducing your immune system's reaction, and here we're giving them an allergy test to see what the immune reaction is. So I just wanted to throw that out there with parents because we worked with our allergist and said she's on this, and he and I talked about when the best time would be for testing, and you go back to your rheumatologist and make sure if it changes the schedule of metho to be able to get that window of a decent, result. The other thing is I've heard from different doctors, one being our pediatrician, whose husband is also a doctor in research, about staying away from probiotics for these kids. I know I used to push the yogurt with the probiotic. I used to give my daughter probiotics, and they said, don't ever give your kiddo a probiotic, but maybe a prebiotic. Could you speak on that?
Yeah, absolutely. So the main concern about probiotics was in cancer patients and patients that had such a low immune system and a lot of gut leak that you're going to give good bacteria and it's going to leak past the gut. In the outpatient setting, there's not they haven't seen those same case reports. The yogurt is tricky because that's lactobacillus, and there is some lactose intolerance in our patients. So oftentimes trying to push the yogurt can be problematic. The stay away from a mentality gets a little bit tricky, and that's why I always say, work with a nutritionist. I think that it's an individualized personal approach. But I do think because if you're getting antibiotics and you're killing off the good bacteria, probiotics are used in children in that setting. So certainly in that setting, I don't think would be any good science to say stay away from it. I do think that any supplement or anything we're giving our body pales in comparison of that which gets nutrients, which is natural or nutrients. So that's the prebiotic thing. Okay, and that would make perfect sense if you could give fiber and that makes the good bacterial overgrowth, that's better, right? That makes sense. The problem is sometimes when you have bacterial overgrowth and you are sick and you put a lot of prebiotics into an already sick gut, patients feel worse. And in particular, they feel really sick. So that's where I feel like probiotics may have more of a role. The tricky thing, though, is to speak to the point of never take them. That's because they're not FDA regulated. So, it's the purists would say anything not FDA regulated, don't take. Just because they're not FDA regulated doesn't mean that you need to avoid them. You just need to do it cautiously and be aware. But I think that's probably what they're speaking to. I would say people on TPN or peripheral nutrition know you wouldn't want to put bacteria in a gut that's not seeing nutrition. But in the traditional outpatient setting, particularly if there's been recent antibiotics, I think that's okay.
Okay. And one more question, and I'll
Please.
pass the mic.
No, that's
The other question was, we're going to be taking B12, and I know there's different types of B12. I know that the B12 the methyl B12 is like a superstar B12 that everybody seems to do well on. But I've seen some research on how hydroxy B12 is more appropriate for those fighting either inflammatory diseases. Do you have any input on that piece?
So good. This is an excellent question because it speaks a lot to our vitamin supplements in general. So I do caution folks. There's a lot of petri dish sort of science that is done that doesn't take into the complex changes that occur in our bodies. And the reason that's such a tricky question is it depends on the status of your gut, because the more we rely on the gut to do its job, probably the better we are. So you give the most natural source, your body recognizes it's processing it and taking the nutrients it needs. What risk we do when we get these modified forms is they're changed by stomach acid. So that's even influences your child on a proton pump inhibitor or not.
But what if they're injectable?
Oh, the injectable form. I would say research, particularly in pediatrics, would not support that statement. In the adult population, I also don't think it necessarily supports that in the absence of like a pernicious anemia, where we know that you don't have the ability to change it to a more robust form of the medication. But I do think that speaks really well to the different formats that are available. Are you able to track it? So if you have a low B12, you take B12, you can then track. If you're taking a form that's not modified and you are unable to raise your B12, then there would be a role for the injectable. Thank you.
I don't know where to start. Okay, so my daughter has linear, not systemic, but we also have celiac, we also have thyroid. And I feel like I'm in a fight with a GI because they say, oh, take probiotics, take fiber, but we continue to have abdominal pain even though her TTG and IgA they're like 10. So when it started at 400, that seems pretty normal to me.
Right.
Is there a list of labs I should be running? I've tried to get them to do allergy testing. They say, oh, that's pretty invasive. That's not invasive to me.
No.
How much do I push for more?
So I think a good resource, did you go to Maren Kinkinney lecture yesterday? So I will give you her contact because she has a PDF that was super thick. They couldn't print out because it was too many papers. So she's in Utah, and so when I say, I refer folks to Maren or to a nutritionist for further testing, that gives you the ammunition if something's you have a handout to give the physician, because most of the time the physician just doesn't understand where to go, and that's why I freely say I get to this point and I go to the nutritionist because that's their wheelhouse. They're experts in that area. So I will give you that contact. I'll circle. I think it's on there. And Ryan Burrell, who's on the contact for Scleroderma Foundation, has it. It has all, in her PDF, it has all how to get the testing for the micronutrients that you may need. And it talks about a different type of diet, a detox diet, that when sometimes you feel like, I talk a little bit about the FODMAP because I think that makes perfect sense. That's safe to start with. But a detox diet done with a nutritionist sometimes can be done to just reset and get things going. And she's a master at this process. So I think that handout, bring it to your gastroenterologist. Say, I went to Scleroderma Foundation. Here's a resource. Here's the name of the lab. These are the tests that I need. That might be the best way to go with that.
Hi, I have a question that is related to accessing information. Because I can tell you that after my daughter was diagnosed with scleroderma, she has non-systemic, I started getting a huge amount of unsolicited, questionable information. And there isn't, I'm just wondering if you can recommend any online resources. We do not qualify. My insurance did not, would not cover seeing a nutritionist. They said not until renal problems might present, and again, I don't want, mercifully that hasn't happened. And to give you a sense of how much our nutritionist would have cost, it was about $235 through the hospital for the first consult. And everyone's well-intentioned, it just wasn't going to happen. So how do we protect ourselves from a huge amount of very questionable information online that's really not appropriate for the pediatric scleroderma population? I'm almost more concerned about the people who are not in this room than the people who are, who probably have very good doctors and solid medical advice at home. But we are a relatively small population who are trying to keep our kids healthy before any problems might present.
So first of all, wonderful question and a real concern, really for our whole community. And it is very frustrating that insurance companies have the ability to do that. I do think Marin's handout that that has this functional medicine information to give to your provider is the first step. So most of the local physicians that you're going to be working with are willing to do something with credible information. I would use your provider as that vetter. So you're absolutely right, and I'll maybe give an example. Someone asked to meet with me about a supplement, and very nice gentleman, came to my office and wanted to talk about a supplement. I heard later and I said, I'm always, information's power, I'm happy to hear it. I heard later that he was telling folks that I use this in my scleroderma patient population. And I was fairly outraged. I said, that was ridiculous. He came and talked to me about a supplement. He's telling other providers that I'm using this supplement. To speak to that point, you have to be really cautious who's endorsing what and whether they have any financial interest in the product. So I see a lot of people go to functional medicine doctors and they get testing and then they buy all these supplements, and I think that can be dangerous. You do want to be able to know if the proposed diet makes sense for your child, and that's really a two-step process. One is knowing sort of natural ways for your nutrients. Like the most fruits and vegetables you can get into your child in a healthy way is your goal. But you want to be able to understand volume and nutrient deficits. So that's really what a nutritionist would do. They do that credible testing, which Marin's handout will have what lab she uses. Then being able to work with your pediatrician on diet and calorie counting and how how your child's symptoms are feeling is the step. It's a slow process. So using those questionnaires to kind of have, if a good day versus a bad day, understanding how many calories you're getting in your child, what natural sources of nutrients, and then only supplements under the guidance of a nutritionist, I think are fundamental. And again, if you get something on the internet, I would really discourage you from just kind of taking it at face value without first bringing it to your physician, having them vet it. And most of the time, your physician should be comfortable doing that. Pediatric gastroenterologists, like the adult gastroenterologist, it's really hard when you do a scope from above and a below and everything looks fine, but there's still symptoms. And that's really where that FODMAP, again, it's developed for adults, but it really is very somewhat simplistic. It takes out artificial sugars, it takes out dairy. It tries to help get you a guideline for how you can move forward. So I like the FODMAP, that Stanford handout with that reference, just to start with, for 6 weeks, so you can try to identify things that make your gut feel bad, and then you try to liberalize it. Now, if you've already done that, you said it's not helpful, I just don't know what else to do, I do think your physician could probably appeal and really try to get you a nutritionist. Because the appeal letters, it just takes vigilance.